Good afternoon, everybody. Thank you for joining us today. We apologize for both the date change and the time change that we had to do this time. Could not be avoided, unfortunately. We want to thank you for joining us, though. And just as a reminder, today's webinar is from 1:30 to 3, as well as our next webinar, which will be on teen dating violence on February 27th. That one will also be believe from 1 to 2:30. So there will also be a different time on that one that we will be announcing soon. So be sure to double check that time if you plan to join us for our next one. Today we have our beautiful Autumn with us, and she's going to talk to us about eating disorders, signs, symptoms, screening, and referral. I'm just going to do a quick intro to Mission West Virginia in case you're new with us. Who is Mission West Virginia? So we're leading a statewide effort to promote positive futures for all kids in West Virginia. We work alongside families as they navigate West Virginia's foster care system and provide evidence-based life skills education to help teens envision and create positive futures. As a result of our work, putting kids first in collaboration with social services, school districts, private foster care agencies, and other nonprofits, the future looks brighter, for West Virginia. So we do this through several programs. First is Frameworks, which provides support for those interested in foster care or kinship care to understand the system, find a placement agency, and prepare to make a meaningful difference in the life of a child. If you're interested in fostering or learning more about foster care, you can call our office at 866-CALL-MWV or 304-512-0555 for more information. You can also request an information packet on our website, which is missionwv.org/request-information. We also have our Think program, which is what brings you this webinar today. Think stands for Teaching Health instead of Nagging Kids. It empowers teens to make positive life choices through education, life skills, and coaching. Our program is evidence-based and helps the students we work with navigate the social emotional pressures all teens face as they develop. This includes building healthy relationships and healthy choices around drugs and alcohol and pregnancy prevention. So we deliver our program in partnership with schools in 20 counties. We are vetted by district leaders, teachers, and other school leaders who are trained to work with kids. The program's evidence-based curriculum has been shown to have a positive effect on preventing teen pregnancies, sexually transmitted diseases, or sexual risk behaviors. Our educators are continually trained on the most up-to-date information on trauma, sexual health, and high-risk behaviors. Our management team does on-site observations of our educators regularly to ensure fidelity is being followed. We also administer pre- and post surveys, receive teacher feedback, hold team focus groups, and site satisfaction surveys. We also host workshops and trainings, much like this webinar today, because we know it takes a whole community to help teens envision and create positive futures. Excuse me. So this is why we also provide resources and training to equip parents, families, and the individuals who support kids as they navigate their teen years. We have various topics, including talking to youth about sensitive or hard topics, hidden in plain sight, trauma, sexual assault prevention and consent, teen dating violence, and we do so much more. Oh, excuse me, I'm sorry. Today's webinar, we will provide 1.5 social work CEUs. You will get a certificate after the presentation within the next week. It will come from the website SimpleCert. And if you have any questions, please email Becky at rwhite@missionwv.org. But check your spam folder or junk folder before you email us, because sometimes it will go there. All right, let's meet our speaker. If you haven't met Autumn yet, she is amazing. But she's our Adolescent Support Coordinator here at Mission West Virginia. She has a bachelor's and a master's degree in social work from the University of Akron and is an LICSW in West Virginia. In her position, Autumn works closely with students who identify a need for resources or community referrals. She also provides education on numerous topics and acts as a bridge of support for students needing a trusted adult to speak with and help them work through any difficult situations they may be experiencing. So let's welcome Autumn. Thank you for sharing this with us today. And I'm going to turn it over to you.
All right, thank you. Make sure, where's my camera? Here we go. Okay. I'm eventually going to be turning it off because, we know how West Virginia Wi-Fi is. So thank you everybody for being here. I hope everybody is safe. I don't know where everybody is at, but those were some crazy storms that we got last night. And it was just mind blowing to see how much flooding had happened in such a short period of time. So I hope you all are safe and your loved ones are safe. But it's just been a crazy, crazy winter. So let me go ahead and get my presentation pulled up and I'll share it with everybody. Let me do that. Okay, so we will go ahead and get started. So today's topic is on eating disorders. If any of you have listened to me talk before or done a presentation or have just talked to me in person, you will know that I have such a huge passion, not just for mental health, but eating disorders as well. Just because this is something that hits close home to me that I share or I will be sharing in today's presentation. So, anytime that I do a mental health presentation, I always add disclaimers. I usually do this more so for my students, but my presentation should not be used as a diagnostic tool, but just for you to learn and your educational purposes. I have so many young students that are diagnosing themselves with any and every mental health disorder. I think social media has been a big part of that, which I can't be too mad because I love that people are opening up more about their own stories with eating disorders and other mental health disorders, because it helps to break down that stigma. But our kids don't understand how diagnosing works. So they are always messaging me or talking to me saying, they have this and that. And yeah. So I just always encourage people, if you are ever concerned for yourself or somebody else, please make sure you are taking them to a licensed professional so they are getting the appropriate treatment. So, when we look at what eating disorders are behaviors that are ongoing. So, a person that's struggling with an eating disorder is not going to do it just one time and never do it again. But basically, eating disorders are a persistence and disturbance in eating behaviors. There are different reasons why people may engage in an eating disorder. They always are associated with distressing thoughts and emotions. So those distressing thoughts and emotions could be anything from, negative body image, low self-esteem, being unhappy with the way that they look. Maybe there's some body dysmorphia there. They may be experiencing bullying because of the shape and size of their body. But also, people can engage in eating disorders that have experienced any type of trauma. And so, people can turn to an eating disorder, not necessarily for, because of weight or body image issues, but because they're just trying to cope with the painful and distressing emotions that they have experienced. Eating disorders are very, very serious conditions. They do stand out apart from other mental health disorders, whereas, our mental health disorders primarily impacts our brain. And although eating disorders is a part of that as well, they are also very damaging to a person's physical health. So we have a bunch of different types of eating disorders that we see up here on the screen. So the first three, anorexia nervosa and bulimia nervosa, these are most commonly diagnosed in teens and adolescents, and binge eating disorder is most commonly diagnosed in adults. However, teens can be diagnosed with binge eating disorder just like an adult can be diagnosed with anorexia or bulimia. But these three eating disorders are three most common eating disorders diagnosed here in the United States. So we have orthorexia, avoidant restrictive food intake disorder, or you may have heard people call that ARFID. We have other specified feeding eating disorders, and we also have pica. So orthorexia is not typically in our diagnostic manual, but it is something that has become more of an issue that they are having like a diagnosis for it. So orthorexia is similar to anorexia, except they have a very, they have a very, let's see, like they are obsessed, a very high obsession with eating extremely healthy 24/7. And so it's not necessarily about losing weight or body image, but they just have this obsession with eating healthy. And that obsession gets to a point that it starts interfering with their day-to-day living. We also have with the ARFID. So this is like a picky eater, but very, very intense. And so it is, they do restrict food, but it's not, again, like orthorexia. It has nothing to do with body image or wanting to lose weight. But basically, they are just extremely, extremely picky eaters and they don't eat enough that allows their body to properly grow as it should. I see this a lot with children that may be on the spectrum or have been diagnosed with some other type of intellectual disability. We have other specified feeding and eating disorders. And so basically, if a person has symptoms of an eating disorder, but they don't technically meet that diagnostic criteria, we will put or we will diagnose them with the other specified. And basically, that is just for insurance purposes and for billing. And so without that code, that diagnostic code, then insurance would not cover therapy. So they kind of created this category for people who are struggling with an eating disorder of some type, but it may not necessarily meet full diagnostic criteria for any of our other ones. And then also our last one is pica. So pica is an eating disorder where a person will consume things that have no nutritional value. This is often seen too with people who have severe mental health disorders such as schizophrenia or schizoaffective disorder. And then we can also see this a lot with youth who are also on the spectrum or who may be diagnosed with some type of intellectual disability. And usually with pica, we see this with people who have severe symptoms of their disability. Maybe they are, more low functioning than other people who may be on the spectrum or have an intellectual disability. And so with pica, some examples of things that people may eat. There used to be a show called My Strange Addiction where there were people in there that had pica. And so they would eat things like drywall. They would eat ashes out of a cigarette tray, chalk. It sounds horrible, but it's really a disorder that they still don't fully understand. But those are the types of things that people with pica would consume. There's no nutritional value whatsoever. So when we look at causes for an eating disorder, usually it is not just one thing that causes one. I always tell students it's usually a combination of things that play in a person's life, and a part of that could be internal factors, but also external. And it creates this perfect storm. So genetics play such a huge role. We know genetics play a huge role for everything, including physical health issues as well as mental health. But if a person has first degree relatives, such as parents or siblings that have struggled with an eating disorder, it does put that person at a higher risk to develop one in life as well. Our next one is the environment. This is one that I am seeing probably the most that's going on with young people that are struggling with eating disorders. So, the environment, we're really looking at the cultural pressure that is out there that is idealizing particular body types. And these body types are not realistic. And it's putting these unrealistic ideas in our young people's heads like, oh, well, if I want to be attractive or successful, then I need to look like that. And the same thing goes for guys as well when they are posting pictures showing, these, people that are very muscular and very fit, but also, they have no flaws on their skin or body whatsoever. And so, our young people don't understand that the things that they see on social media, that it's not necessarily 100% reality. So I do try to educate them and remind them that most of the things we see on social media, a lot of that has been filtered or photoshopped. But also too, these people are not disclosing that they have had, surgical procedures or fillers or Botox. There have been lots of doctors and surgeons that have come out and said there is no diet or exercise routine that a person can do that would give them these unrealistic body types that we see on social media naturally. Social media can be a great thing, but it's also causing a lot of issues for our young people. Peer pressure is another really big issue that I'm seeing in schools when it comes to eating disorders. But I am, hearing of young people that are being teased and bullied because of their weight, or they, look different than the majority of other students. And so this, again, another point that I really push onto the students when I teach them this stuff is that they need to know that words matter and they don't know how hurtful and how damaging words are. And so I always try to encourage them to just, I'm not expecting you to be best friends, but if you have nothing nice to say, then just don't say anything at all. Because I am seeing young people that are starting to not eat at school anymore because they've been made fun of while they're eating lunch, or they're being made fun of because of their weight or the size of their body. And then we also have emotional health. So there are some characteristics that a person may have that can put them at a higher risk to develop an eating disorder. Perfectionism is one thing. And so, with perfectionism, we all want to be successful in life and do well and, and just do something with ourselves. But other people may take it to another level where they have this extreme high perfectionism, where they feel they have to look perfect, be perfect, and they have to act perfect. And the problem is, we know that nobody is perfect. So when they fail to reach that perfectionism, that's when that negative self-talk starts to come into play. And then all of that negative thinking, if it has anything to do with their looks or their weight, or the shape and size of their body, then that negative thinking can kind of tie that together and start having those thoughts of disordered eating. Another is it being impulsive. So if somebody is more impulsive than typically other people, that puts them at risk. And really, that's just because they're not thinking through of potential consequences of their behaviors. And this is really tricky with teenagers as well, because in our brain, in the frontal lobe, there is a part that controls our impulses. And that part of your brain is not fully developed until you're at least 21, around 22. So our teens are going to be more impulsive and they are going to act out and do things without thinking through, hey, if I do this, how is this going to hurt me? How is this going to impact my life in a negative way? So that's why teens and adolescents are the highest risk years for people to develop eating disorders. And then if they have had a history of physical or sexual abuse, and honestly, I say any type of trauma, because we all handle trauma differently, and we all see it differently. So any type of traumatic experience that a person may have gone through can put them at a higher risk to develop an eating disorder. And again, that is their way of coping, and it's kind of a way of releasing that emotional pain in that way. So eating disorders doesn't discriminate. There's always this misconception that it's just a young teen girl problem, and it doesn't happen to anybody else. But it doesn't discriminate, and it can happen to anybody, regardless of their age, their gender, their sexual orientation, their race, their religion. However, it is most common for symptoms to begin with females between the ages of 12 and 25. And again, adolescence is the highest risk time for the development of an eating disorder, because that is when they are typically going through all of these things. They have that cultural pressure, the peer pressure, and they're also experiencing a lot of the emotional health as they're aging and trying to figure out who they are. Guys are impacted by eating disorders as well. And in the United States, it impacts at least 10 million males at some point in their life. But because there is that stigma with mental health and asking for help and getting treatment, more so for men, they are much less likely to seek treatment. Athletes are also at a risk to develop an eating disorder. And this is for both, for all genders. I used to see this often with people who would participate in things like cheer, dance team, ballet, or gymnastics, any type of activity where they felt they had to maintain a smaller body shape and size in order to keep performing. But then also for another sport that we have seen eating disorders appear is with wrestling. And so wrestling, when I was in high school, I had a group of guy friends, and when it came time to wrestling season, they were engaging in disordered eating all the time, depending on if they had to lose weight or gain weight. And the school knew that it was happening, but they really didn't say anything because we had such a great wrestling team, and that's what was important. But what the school didn't know was after wrestling season, was coming to an end and, kind of shutting down, a lot of my guys still struggled with those disordered eating behaviors. And a lot of that has to do with, when you're engaging in a behavior and you're doing it every day, maybe a couple times a day, it's going to turn into a habit. And the longer somebody is engaging in those habits, the more difficult it is for them to just turn that off. We are also seeing that rates of eating disorders and body dissatisfaction is happening later in life, midlife and beyond. They aren't necessarily sure what the reason for that is. I do feel a part of that has to be social media as well. Just because we may be older and we're adults, we're still on social media. We still see things, that we're like, well, dang, why can't I look like that? So I think that may have a lot to do with it as well. And then anybody that's part of the LGBTQ plus. So research has shown that beginning as early as 12, teens that identify as part of this are at a higher risk of developing an eating disorder. And a lot of that has to do with, just being who they are and not necessarily being accepted, whether it's by friends, family, or they're just their peers in general. So looking at some statistics on eating disorders, it affects the population, or at least 9% of the population worldwide. 9% doesn't seem like a really big number, but if you think about the billions and billions of people that are on this planet, 9% does make up quite a large number. And then here in the United States, every year, almost 29 million Americans will have an eating disorder in their lifetime. The next one is very interesting. So, less than 6% of people with eating disorders are medically diagnosed as underweight. And I really try to teach the students on that topic because they always assume that it's a person who seems extremely underweight, that that's the only type of person, that looks that way that has an eating disorder. But I do remind them that less than 6% of people are actually diagnosed as underweight, and that an eating disorder, a person that has an eating disorder can be any weight, any shape and size. They could be underweight, average weight, or they can be overweight. So you can't look at someone's outward appearance to make that determination if they may or may not be struggling with that eating disorder. Again, genetics play a really big role for somebody at risk for an eating disorder. Up to 74% is through genetics heritability alone. And then eating disorders is the second deadliest mental illness. So it has the second highest fatality rates of all mental health disorders. First is going to be our opioid overdoses with substance use disorder. But the most common causes of death for eating disorders, the first one is cardiac arrest. So I educate the kids on how your heart is a very strong muscle, and I teach them how eating disorders can weaken that muscle until a point that it's going to stop and you're not going to be able to bring that back. And then the second other common cause of death is organ failure. And so again, I teach those kids that once we have damage to our organs, we cannot reverse that. Or, once the damage has been done, it's done. So I talk to them about how, the best thing a person can do in that situation is to try to stop those behaviors to allow that progression from getting worse. So organ failure is the second common cause of death as a direct result from an eating disorder. And every year there's 10,200 deaths as a direct result, and that's one death every 52 minutes. About 26% of people with eating disorders attempt suicide. And treatment cost for eating disorders is outrageously expensive. And every year, almost $65 billion is put towards treatment for this disorder. And a lot of that has to do with because we're looking at a bunch of different aspects. So usually when somebody is struggling with a mental health disorder and they require treatment, they may go to an inpatient or outpatient, psychiatric treatment center. And although they may have that for eating disorder specifically, it is also very common for people to be in and out of the hospitals for health issues as a result from their eating disorder. So we have medical cost, we have mental health cost. We also have, there's nutritionists, there's medications. So it's just a very, very costly disorder to treat. So looking at youth and young adult statistics with eating disorders, we talk about eating disorders typically start around age 12 when they may start having symptoms, or it can start there. Unfortunately, I am starting to see elementary school kids that are engaging in disordered eating behaviors, as well as, starting to engage in self-harm. And it's very heartbreaking, to see that these little people, are doing these things already. But 42% of first through third grade girls want to be thinner. 81% of 10-year-old children are afraid of being overweight. 46% of 9 to 11-year-olds are sometimes or very often on diets. 35 to 57% of adolescent girls engage in crash dieting, fasting, self-induced vomiting, diet pills, or laxatives. And then there was a college survey that was done, and 91% of the women admitted to controlling their weight through dieting. So we can see that having these negative thoughts when it comes to our bodies, it's happening in all ages. So we have elementary school, we've got maybe middle school. We're also seeing this in high school and college as well. So it's happening to so many people of different ages. Another issue that can happen when it comes to eating disorders is that it is more common for people to have co-occurring or disorders or comorbidity. So comorbidity or co-occurring is when a person has two or more mental health disorder diagnoses. And when a person has an eating disorder, it's very common for them to be diagnosed with something else. If they have more than one mental health disorders, the co-occurring mental health diagnosis can begin around the same time as an eating disorder. It can start before it, it can happen after it. So there really is no, there's no time frame of, when the second diagnosis can be start where that person can start having those symptoms. But common co-occurring disorders with eating disorders, depression, anxiety are going to be the most common. Next, we have obsessive compulsive disorder. We have substance use disorder, PTSD, and then again, any other type of trauma. So NEDA is our National Eating Disorder Association, and they did a survey on eating disorders and co-occurring disorders. And so out of all of the people that responded with this study, so people that were diagnosed with anorexia nervosa, 56% of them met criteria for one or more other mental health diagnosis. People with binge eating disorder, 79% met criteria for another mental health disorder. And then bulimia, 95% met criteria for other mental health disorders. And so out of that 95% of people that are diagnosed with bulimia, 64% met criteria for 3 or more disorders. And so when we look at treatment wise, that's where it can get really tricky, because it's like, where do we start first? In which came first? So that's why when it comes to eating disorders, it can be very difficult when it comes to treatment. It's definitely a longer process. And that's because we have so many different parts and pieces that we are working with, rather than if we were working with somebody who just has depression. So it's a very, very challenging mental health disorder. So next, I'm going to kind of go into just a little bit more about anorexia, bulimia, and binge eating, because those are our 3 most common. So again, anorexia nervosa, it's definitely a serious and potentially life-threatening eating disorder. And it's when a person is restricting food and they have difficulties maintaining appropriate body weight for their height, their age, and their stature as well. They typically have a distorted view of their body. So just like this picture shows, we have somebody who appears on the thinner side, but when they look inside or at themselves in a mirror, they do not see that. It's like their brain is playing tricks on them and their eyes are playing tricks on them. But they see something even worse that they don't like. And it's kind of what continues that cycle for that eating disorder. People with anorexia will typically restrict the number of calories and the types of food that they do eat. So they may really restrict food if they are only focusing on how many calories per day they are allowed to eat. Some people may completely restrict out any foods that have, a certain amount of carbs or sugars or fat, anything like that. Now, another part with anorexia is that they can also engage in purging, which is primarily seen in bulimia. So, people who are struggling with anorexia may excessively exercise. They may purge by self induced vomiting or abusing diet pills or laxatives. And so that is not, it's not frequent that they do that. And they also do not get diagnosed with bulimia as well. So a person cannot have both diagnoses of anorexia and bulimia. However, people with anorexia can have some parts and pieces of bulimia in that disorder. And then again, anorexia has the highest mortality rate of all psychiatric diagnoses except for substance use. So looking at bulimia nervosa, again, this is a potentially life-threatening and serious eating disorder. And it's characterized by a person going through two different cycles. So the first is binging, and then the second would be our purging. So people who are struggling with bulimia, they typically feel out of control when they are binging on a large amount of food in a very, very quick amount of time. And I try to explain this to students because, they think, well, what they see as binge eating is not what binge eating is with eating disorders. So I always explain to them, sometimes when I would get home from school, the first thing you would do is you'd go to the fridge and get snacks and go to the cupboard or pantry and get some snacks. And you would just kind of hang out and eat those snacks. Well, to them, that was binge eating. But an example of binge eating with an eating disorder would be a person, say, going to, 4 or 5 different fast food drive-throughs, getting value meals from each place, going somewhere quiet and private, and they will consume all of that food within a 20, 25-minute time span. So we are talking about extreme amounts of food in a very, very short period of time. So they typically will do that because they're trying to cope with those painful emotions, but they are also feeling that sense of being out of control as well. So once they are done binging, then they will move on to that other cycle, which would be purging. And so that purging can be done for a number of reasons. So they may be purging because that's their way of releasing emotional pain. They may be purging because if it has to do with body image issues, maybe they're afraid that they are going to gain weight. But they also may purge because they feel they've lost so much control in their life that by consuming all that food and then forcing themselves to get sick or purge however they choose to do so, they feel in their mind that they are gaining some sense of control back. And so, when it comes to somebody who is struggling with bulimia, it's very difficult for family or friends to even notice what's going on. And that is because people who are struggling with bulimia don't typically lose weight. In fact, more people are actually average weight or maybe even a little bit overweight that are struggling with bulimia, which is different than what we see with anorexia. People with anorexia are typically maybe just a little underweight, but they can also be average weight as well. So looking at warning signs and symptoms, so you can see there are so many of them, and they're very similar with anorexia and bulimia. So I kind of just combined them together. So we have emotional and behavioral symptoms, but then we also have physical symptoms. So I'm not going to go through every single one of these word for word. We will make sure that we send this PowerPoint out to everybody so you have all of this information. And like I said, these symptoms they're pretty similar when it comes to anorexia and bulimia. So basically, in general, they have these behaviors and attitudes that indicate that weight loss, dieting, and control of food is becoming their primary concern. There may be a disappearance of large amount of food in a very short period of time, and you may find empty wrappers and containers being hid somewhere. It's very common for people to hoard food, or they will hide all of their trash, in like a secret place, so that people don't see what they're doing. You may find that there's evidence of purging behavior, such as taking frequent trips to the bathroom after meals. This is typically done pretty quickly after a meal has been consumed. People that are struggling with an eating disorder, especially if they are purging, they know that you have about a half an hour after a meal to purge. After that, the digestion has already done its thing for the most part, and it makes it more difficult for somebody to purge. So, if it's like a few hours after they have got done eating a meal, that's probably not something to be concerned about, but it's usually relatively quickly that they will go to the bathroom after they eat. There may also be smells of vomiting, or you may find wrappers of packages of laxatives and diuretics. You can also see too, if they are vomiting, if you look under the toilet seat, you might be able to see splatters. I know it's gross, but for some people, that's how they were able to find out that their loved one was struggling with an eating disorder. They may have feelings of being uncomfortable eating around around other people. So typically with anorexia, they generally are not going to eat much at all around others. And then people that are struggling with any type of binging behaviors, they typically are going to do that in secret as well. They may develop food rituals, so excessive chewing, or they don't like their food to touch, or they only eat from a particular food group. They may skip meals. They may have, again, they may steal or hoard food in strange places. They may drink excessive amounts of water or any type of beverage that has very little calories in it. They may use gum, mouthwash, mints all the time. They may hide their body with baggy clothes, especially if they are losing quite a bit of weight, so people do not become suspicious. They maintain excessive, rigid exercise routines despite weather or being sick or if they are injured. In a quick little story about this, just trying to explain what I mean when I say excessive exercise, we don't mean an hour or two at the gym every day. But I had somebody that I was working with that was struggling with bulimia, and their purging behavior was excessively exercising. And so, another part with eating disorders is that it's also very damaging to a person's bones. It can make their bones become brittle, and it can also lead to osteoporosis. So this person was on a treadmill and they had been running so hard and so fast than what they could keep up with that they actually broke both of their legs in a couple of different spots. They had to have surgery. They were casted in full leg cast and they were confined in a wheelchair during their recovery. And so during that time, this person was terrified that they were going to lose or gain weight being confined in this wheelchair. And they were still trying to find ways to exercise, like trying to stand up and move their legs that were in casts. So that's what I mean when I say excessive exercise. They may have unusual swelling in their cheeks or jaw area, and that's going to be more so from the self-induced vomiting. They can have calluses or cuts or marks on the back of their hands or knuckles from making themselves sick. They may withdraw from friends and families or things that they love to do. They may look bloated from fluid retention, extreme concerns for body weight and shape, always looking at their flaws and comparing themselves, and extreme mood swings. So some of the physical symptoms when it comes to anorexia and bulimia. So you may notice that there's a fluctuation in weight, and that could be both up and down. Body weight, like I had been talking about, body weight with our eating disorders is typically within a normal weight range, but some may be even overweight. So again, just because you think, or or maybe you have a concern, but then you're like, well, they look like they're healthy. You can't use that to determine if they are or are not struggling with an eating disorder. They're going to have lots of stomach issues and gastrointestinal issues, so constipation, acid reflux, heartburn, indigestion. And also too with purging, that can also escalate those symptoms. So if somebody already has some of these issues and this was prior to an eating disorder, this is only going to make things worse. They may have troubles concentrating when they go to the doctor. They do regulatory blood work. They may find that the numbers are all over the place. They may complain of feeling dizzy, or they may faint. They may also feel cold all the time. They can also have sleep problems. This happens more often with anorexia, especially when they are hungry. It's very difficult for them to fall asleep because they don't feel well, because their body is lacking that nutrition, and they are constantly battling the thought of going and eating something versus not. They also can experience a lot of dental problems. So enamel erosion, their gum lines can recede. It can create cavities, tooth sensitivity, and essentially their teeth can fall out. They can also have dry skin and brittle nails, swelling around their salivary glands. Their bodies can also produce fine hair all over it. And so the term that they use for this is called lanugo. So basically, what happens is with an eating disorder, it's common for a person's body temperature to be lower than normal. And so your body goes into overdrive because it is cold and will produce this fine hair all over the body to try to regulate that body temperature. So for me, it just blows my mind to see how our bodies do whatever they can to keep us alive. So it is really crazy. When I first learned about Lanugo, I was just, it's mind blowing. They're going to have different textures with their hair. Their hair may start to thin. There could be some balding spots, muscle weakness. They can also develop a yellowish hue to their skin. And this is not very common, but this has to do with eating large amount of carrots. And so there is a vitamin, I think it's called beta carotene. And so when somebody consumes all of that over time, it can naturally give their skin kind of a yellowish, orangish hue. But we see this more like maybe in their hands and sometimes in their face. They also may have cold, mottled hands and feet, or their feet could be swollen. They may have menstrual irregularities. So they may experience amenorrhea. So what that means that their period stops completely. And now there could be other reasons, such as they may be on birth control that stops their menstrual cycle. And also to people who are extremely athletic, they can experience amenorrhea too. If they have any wounds, they're going to have poor wound healing because their immune system is going to be completely shot. So they are also more susceptible to experiencing getting sick. And then people with bulimia can struggle with the co-occurring conditions such as self-harm, substance abuse, engaging in risky behaviors. And then also there's something called diabulimia. So I actually got to experience this with a patient. This was years ago, but it was a 26, 27-year-old. She was 6 months pregnant. She was a type 1 diabetic, but she also struggled with bulimia. And she also had an insulin pump. And so she was manipulating her insulin pump, and it would cause her to vomit. And so that was a really, really, really tough case, to try to figure out because she needs that insulin to survive. But she was also using it to fuel her eating disorder. And so the last that I heard, because I had called the hospital and we got her admitted and they kept her on bed rest for the next couple of months until she gave birth. But then I had heard that she eventually did get into treatment. So that is also, again, it's not a common thing, but people who are a diabetic that are taking insulin, they can experience diabulimia. So our last one is binge eating disorder. So again, this can be, a dangerous eating disorder as well. But it's basically just recurrent episodes of eating large amounts of food in a very short period of time. So this is similar to bulimia. However, there is no purging whatsoever. A person who experiences binge eating does not restrict food, and they also do not purge. So they're using food as an unhealthy way of coping. But just like with bulimia, they may feel like they are out of control in their life. And so as they're consuming this food, they continue to feel that lack of control. They may also experience feelings such as distress or guilt or being embarrassed or ashamed once they have that binge episode. And then that can fuel them to have another episode. But it's the most common eating disorder in the United States. And this disorder actually is a newer mental health disorder. And when I mean newer, I mean 2013. So prior to that, binge eating disorder was not in the Diagnostic Statistical Manual. So it was finally added in 2013. And then anybody experiencing binge eating disorder prior to that diagnosis, they were just under that, that unspecified eating disorder category. So this is one of the most common eating disorders. And it's, one thing to keep in mind is that when we think of like the obesity rate in our country, we think, oh, they all must have binge eating disorder. But that is not typically the cause. And so binge eating disorder, so somebody who is obese does not always have a binge eating disorder. However, binge eating disorder can cause obesity issues. So some warning signs and symptoms for binge eating disorder these are emotional and behavioral. So again, you may find that there's a large amount of food that's disappearing. You may find empty wrappers or containers, being hoarded or stored in really weird places. I worked with somebody a long time ago, and mom found a bunch of food wrappers in the toilet tank. That's where they were hiding their wrappers that they were eating. And this young person was struggling with bulimia. They may have, all of a sudden start practicing new diets or cutting out entire food groups, having fear of eating in public or with others. They may steal or hoard food. They may create lifestyle rituals or schedules to make time for those binge sessions. They may show extreme concern for their body weight and shape, checking out their flaws all the time, eating alone, feelings of disgust, depression, or guilt, and feelings of low self-esteem. And then some of the physical symptoms with binge eating disorder, again, there could be fluctuations in their weight, and that could be both up and down. They're going to experience the stomach cramps and the gastrointestinal issues, just like with bulimia. They may have difficulties concentrating. And then, oh, here we go. This is what I was talking about with the last one. So most people are labeled clinically obese do not have binge eating disorder. However, individuals with binge eating disorder, up to 2/3 are labeled clinically obese. And again, people who are struggling with binge eating disorder can be any, normal or higher than average weight, but it can be diagnosed at any weight. There isn't anything in our diagnostic criteria saying a person has to meet this weight in order to fit that diagnosis. So the internet, social media, and eating disorders. So the internet, I love the internet, but I also hate it. So there are some things online and websites that promote people to continue engaging or their eating disorder or to encourage them to begin one. So there are some websites and social media posts that they refer to this as Thinspiration or Thinspo. You may also hear people talk about pro-MIA or pro-ANA websites. So MIA stands for bulimia and ANA stands for anorexia. But again, these websites and these accounts, they are usually by other people who are experiencing eating disorders. And so they encourage them to continue, but they also will provide them tips and tricks on how to hide their eating disorder, to post pictures of, how they look from their eating disorder, how to purge, more effectively. So really, it's just trying to encourage people to stay, engaged in their disorder. A lot of times people will create the Pro Me and Pro Anna to obtain support from other people just to help them feel understood. But this is also really harmful and damaging to a person. And it allows them to be vulnerable to develop one, and it can make them feel more negatively about themselves. It could stir up damaging feelings, and it also pushes them into setting unhealthy goals and rules for themselves. These Pro Anna and Pro Mia websites, it also is telling people that they are harming themselves by choice rather than because they have a mental health disorder. And so that's where it gets really difficult to try to coerce people into, or not coerce, but encourage them to get help, because they truly do not believe that they have a mental health problem. They think that it's something they have under control, they can stop at any time. So a lot of that, can come from some other people that, have told them these things. So I went and, on social media, just defined like some things that, that I have seen that is promoting eating disorders that could be triggering for people who, are struggling with low self-esteem, or if they're already engaging in an eating disorder. So some of these are, they may be disturbing. So I just, like to put that disclaimer. So we have over here, with TikTok, we have our 10 weight loss tips. So, we can see that this person is, that they're thinner, they're fit, but, they're encouraging, oh, if you do these things, then you're going to get a body like mine. We also have this person here who is showing off their bones and their chest. This anorexic nation. So this would be a really good example. This is obviously a much older website. It probably is not even still around, but this is what was, of like, they had this stuff like when I was in high school, like online. This is kind of what the websites look like, where it glorified eating disorders, and encouraged people to, continue engaging in them. And then we have here Instagram, Anorexic Bones. She's showing off how, or they're showing off how they can put their hands around their thighs. There was a part or a time not too terribly long ago where everyone was talking about getting that thigh gap, that you were not attractive unless you had a thigh gap. And a lot of people would come out, like doctors, saying that most people do not have that thigh gap. And it's really like you shouldn't have that thigh gap. So then I went moved on to Pinterest, because I'm like thinking, well, Pinterest that's pretty harmless, right? Well, I found, quotes that, could be triggering, or that would be considered a inspiration. Like basically saying here, what I look forward to, being asked, did you lose weight? Or nothing tastes as good as skinny feels. You want to binge, keep telling yourself later, soon enough that later turns into never. So again, social media can really create more issues, for people who are struggling with an eating disorder. So real quick, I just want to go over my personal story. Oops, my bad. So, I struggled with bulimia, throughout high school, and a little bit into college as well. And so throughout my disorder, I really struggled, because at that time it was mostly seen that eating disorders were because people didn't like how they looked. They thought they were overweight and they wanted to change the shape and size of their body. And that literally had nothing to do with me. My eating disorder stemmed from trauma that I had never worked through, and just experiencing a lot of other difficult things in my life. And I felt that I had no control over my own life. And so it was just something that I felt I could control, but it was also my outlet to release that emotional pain. And so it was able to keep it a secret for a while, but some friends told on me at school. Of course, I was extremely angry. And, I was a senior in high school. And so I had to go to treatment. My doctor forced me into treatment. And, what was really sad is, this was, gosh, 2002, 2003. So this was a while back ago. However, unfortunately, when it comes to treatment and resources for eating disorders, I have seen not much improvement over all of those years. So where I lived, we did not have any inpatient treatment specific for eating disorders. Most people that need inpatient treatment have to go out of state. Not every state has an inpatient treatment center. And the problem with those two is they are extremely, extremely expensive. Most people have a really hard time affording it, and a lot of insurances are not going to cover the entire thing. So my treatment that they found to be, what was best for me was putting me in an adult psychiatric unit at a hospital for about 2 months, where I got cookie cutter treatment for everybody else, that was there for schizophrenia or self harm, or bipolar. And, there was just no consistency with the treatment. It was just, okay, you would do your recreational therapy, your art therapy, and nobody ever talked to me about why I was doing engaging in my eating disorder. They were just trying to, it's like manage the symptoms, but essentially they were putting a band-aid over a bullet hole. So when I got out of treatment, I continued to struggle. However, I just knew how to hide it better because I didn't want anybody to find out about it. When it got to a point that it kind of reminded me of somebody who's struggling with addiction, where you get to a point that you're just so beat down and you're so tired of living life the way that you do, that you realize you have to make changes or nothing's ever going to get better. So I was very blessed to be able to have that mindset where, at such a young age, I realized I needed to make changes and I needed to get help for myself. So I was able to, you know, go and get set up with a therapist, and and just doing my own research and looking at different tools and resources online, to help. And so I have been in recovery, this whole entire time. And I always tell people that, when we look at eating disorders, it truly is a recovery process. I have to make sure that I am staying on top of my own mental and emotional health, because at any point, if I am disregarding what's going on in my life and not taking care of myself, at any point, I can always relapse and go back to those behaviors. So it really is a lifelong recovery and something that you have to continuously stay on top of, in order to maintain that recovery. But I will say it's absolutely worth it. So when we look at, helping somebody, friends and family are often the key to encouraging their loved ones with eating disorders to get help. But it's a very difficult for people who are dealing with an eating disorder to seek help. It's also difficult for them to open up and say, "Hey, I'm struggling and I need help." I never told anybody. The school called my mom and my dad, and then my mom and dad waited about a week, to before they addressed it with me. And I just lied to them. I just kept lying and kept lying, until finally I kind of gave up. Um, but if you're ever concerned about a loved one, or anybody that may be struggling with an eating disorder, you should not expect them to open up to you first. They are typically going to keep all of that inside for as long as they can. Especially because there were times in my life where I needed my eating disorder. That to me was my only outlet. That was the only thing that would get me through the day. And I didn't want anybody to take that away from me. So of course, I wasn't going to tell anybody. So again, you have to make sure that if you're concerned, you need to, unfortunately, probably are going to have to be the one to bring up that conversation. And again, it's not always easy talking about it. I do feel bad for my parents. That whole week, I knew that they knew what I was doing. I could tell by the way they talked with me or watched me. I would go to the bathroom and wouldn't even be there for 2 seconds, and somebody's knocking, "Are you okay?" And so I know that it was not easy for them to try to bring up that conversation. But you know what? I'm glad that they did. So when we are going to talk to somebody about their concerns for a possible eating disorder, some things that you can do, first learn as much as you can about eating disorders. If you have some general knowledge about eating disorders and you are talking to somebody who may be struggling, if you have kind of a better understanding of how they works and why people do it, the different types, then the person that is experiencing it, they may be more likely to open up more. They may trust you more because you have some type of familiarity with what they're experiencing. Also, when we go to talk to somebody, especially when it comes to an eating disorder, practice what you want to say. It's going to create a lot of anxiety. We don't know how that person is going to react or how they're going to address the situation. I will tell you, with my parents, I did not play very nice when they addressed that with me. I made everything as difficult for them as I could be from the time they addressed it with me and throughout my treatment. I remember it's kind of funny. I feel like I can laugh about it now, but I had asked my mom something. I had asked her a question about if she remembered, what they may have said to her when I was in the hospital about something. And she said, "I really wouldn't know, Autumn, because you were 18 and signed the form that refused your dad and I to get any information from from them." So, so yes, we will put up a fight. Just be prepared for that. So again, practice what you want to say. Write down the main points that can be helpful, because if we have a lot of anxiety and stress going on about having this conversation, we're probably going to forget the important things we want to say. Also, make sure you do this, set a private time and place to talk. Do not talk about these personal types of issues in front of other people. Make sure you're being honest. If you avoid it, ignore it, pretend it's not there, it's not going to make it go away. And if anything, it's only going to make that problem so much worse. You also want to use I statements. So I statements, you're focusing on behaviors that you have seen that person do. So I always tell students, when we talk about I statements, because if you go to talk to someone and you address it as, well, you're doing this and you're not doing that, they're going to become defensive. They're going to feel as though you're backing them into a corner, you're pointing the finger at them, and it's not going to be a pretty scene. However, if we use the I statements, "Hey, I've noticed that you're no longer eating at school anymore. I'm worried about you." It's really hard for them to argue that because you've seen them do that. So they can't really say, "No, I'm not doing that." You also want to make sure that you're sticking to the facts. So, talking about eating disorders may potentially bring up a lot of intense emotions from things that have happened in the past, and it can totally take over that conversation. And again, that is going to be our way of trying to change that subject, because essentially we're just trying to protect ourselves because we need that eating disorder. In our mind, that eating disorder is our lifesaver, and we are not going to, let anyone take that away. So make sure you're talking about the behaviors that you've noticed and try to calmly explain your concerns. When you are talking to somebody, you want to make sure that you're caring and you're coming off as kind and caring, but you also need to be firm, and you also may have to put your foot down with people. Just because we are caring does not mean that we are being manipulated. And you have to know that a lot of people that are struggling with an eating disorder will often lie, cheat, and manipulate in order to allow their disorder to keep going. So you want to make sure that, they are not doing anything to manipulate you. And they also need to be responsible for their actions and also for their consequences. Yes, they are going through a lot and they are struggling, but that does not give somebody a free pass to not be responsible for themselves. You also want to avoid making rules, promises, or compromises. Another thing that we are really good at. I won't do this anymore as long as you fill in the blank. I promise, not to tell anybody, or if you do this one more time, I will. So just, avoid making any of those. Don't make any promises or compromises, because people who are struggling with an eating disorder, we are going to break those. You also want to remove that possible stigma. Again, there's a lot of stigma still in 2025 when it comes to any type of mental health disorder. So just reminding them that there's no shame, nothing that they need to be embarrassed about, and just informing them that there are millions of people that are diagnosed every day, but a lot of people recover. And also, please avoid the overly simplistic solutions. This drives me absolutely batty. So when somebody is struggling with an eating disorder and someone's like, well, just eat, that's not going to help. Or if they're struggling with depression, well, maybe if you just smiled, you'd feel better. Um, that is absolutely bizarre. But it may leave the person struggling like you're not listening to them. They may feel misunderstood and angry. And then that in turn may shut them down from talking to you. Again, you want to be prepared for some negative reactions. We can become very angry. We also, again, a part of the manipulation is the reverse psychology. So we are going to, or we can turn this around on you, and we are going to say what all of your problems are, and that you are the one with the issue, not me. Or we may brush off or minimize what you're saying to us and the concerns you have for our behaviors. But you need to know these are all normal responses. Again, we are we're kind of in fight or flight mode when we are being confronted with our eating disorder, and our agenda is to protect that and to maintain that eating disorder for as long as possible. So again, be prepared. It may or may not happen, but regardless, if there are a lot of intense negative reactions, those are normal. So again, you just want to repeat what your concerns are, let them know you care, and you can leave that conversation open. You also want to encourage them to seek professional help. It almost requires professional help of some type, whether that's inpatient, outpatient, whatever, for treatment for eating disorders. But you can offer to help them find a doctor, a therapist, or a psychiatrist. And then there's also some resources I have at the end that you can actually contact places that can help with the referral process for eating disorders. It's also important to know that getting timely and effective treatment dramatically increases a person's chance for recovery. So one of the problems that we have seen, and they have done research on this, is that there is an average delay of 8 to 10 years from the time a person starts experiencing symptoms of any mental health disorder until they go and get help. And that is far too long for somebody to have to suffer, especially in silence. And also, we know the longer a person waits to get help, the more difficult it may be for them to feel better, but it can also take a lot longer. So I always say the sooner the better. You also want to make sure that you are talking to someone. Again, sometimes they may tell you to keep it a secret. I tell this a lot with my students, to never keep that a secret, and to make sure that they're getting help right away. But if you are really struggling, or you have a lot of concerns for a loved one, this can also be a very draining mentally and emotionally process for yourself as well. So make sure that you are getting support from family and friends. And if you need to, it is absolutely okay for you to seek out your own therapist, to make sure that, you have that outlet and you are getting that support. Because you also have to remember, if we ourselves are struggling, it's really hard for us to be there for other people. So we also need to remember that mental health is a recovery process. And unfortunately, there is absolutely no cure. So you're going to have good days. You're going to have bad days. We're going to have relapses. That is just all a part of the recovery process. And that not just eating disorders, but really for any mental health disorder. So an emergency, if you ever suspect a medical or psychiatric emergency with somebody that is struggling with an eating disorder, your best bet is to seek medical attention or call 911 immediately, especially if they are making threats of suicide or if they are fainting, having heart problems, or if they start having seizures. So this is just a little video from Nita that just talks more about ways that you can help someone who may be struggling with an eating disorder.
Recovery is real. Help is available.
People often notice that a loved one or a friend is changing their eating behaviors or their attitudes toward food, towards weight, towards their size, towards themselves. It's really important to express your concerns about this in a loving and caring, supportive way. But also it's important not to wait too long, because the longer an individual is walking into the path of the eating disorder, the more physical and emotional consequences they'll need to face.
Learn about eating disorders so you will recognize the signs when you see them and know the difference between myths and facts.
Set aside some time to have a private conversation with your loved one and voice your concerns in a way that is honest and sympathetic.
Remind your friend and your loved one that you care about them and you just want them to be healthy and happy.
Be prepared for a difficult conversation. Someone who's struggling with an eating disorder is already scared, and it's extremely difficult for them to hear this kind of conversation. So when you do it with love and attention to their needs, not yours.
Share your own difficult experiences and painful emotions. It can be really important for them to know that they're not alone and that there's nothing wrong with them for struggling.
Don't give advice about weight loss, exercise, or appearance.
Avoid placing shame, blame, or guilt on your friend regarding their actions or attitude.
Don't oversimplify. Avoid saying things such as, if you just started to accept yourself, everything would be all right. Or if you just started eating normally, everything would be fine.
Use I statements. For example, I'm concerned because you don't eat breakfast or lunch, or it makes me afraid to hear you vomiting.
Set boundaries to preserve your own emotional well-being.
It's important to suggest that they seek professional help from a physician, a dietitian, a therapist, someone who understands eating disorders.
One of the most important things you can do is educate yourself about eating disorders. Dig into the facts. Go to the NIDA website. There continue to be lots of myths and misconceptions about these disorders, and you need to educate yourself about what's true.
I know I'm not the only one that struggles with body image and eating disorders.
My life in recovery is more beautiful than I ever thought possible, but I had to make that commitment to myself.
Okay, and so here are the resources. So NIDA is the National Eating Disorder Association. They have a really, really great website. And actually, this was a good time for this because we have the National Eating Disorder Awareness Week coming up here soon in the month of February. And NIDA usually has a lot of activities going on throughout the country, and they also do a lot of walks for people that are in recovery, or if you're just supporting somebody who is in recovery. They have an online chat where you can talk to people and ask them questions. And then they can also help with referrals to locate treatment centers for eating disorders. They have lots of great information and resources. And then they also have a crisis text line. So if you text the word NIDA to 741-741, you will be connected to a crisis worker that specializes with eating disorders. We also have NAMI, which is our National Alliance on Mental Illness. This has lots of great information on all mental health disorders, including eating disorders as well. ANAD is our anorexia nervosa and associated disorders. It's similar to NIDA, but they have a lot of great information and resources. They have a treatment directory and referral program, just like NIDA. But one thing that they have is they have an online support group too that's moderated by mental health professionals, so people can go on there and talk to others. And this is moderated, so it's not going to be any of your Thinspiration or your pro-Mia or pro-Anna thing. They have a phone number where you can call and talk to people about anything regarding eating disorders, whether it's for yourself or if it's for somebody that you know. And then they also have a peer support mentor group. And so basically, it's a mentorship program where a person in recovery will mentor someone who is trying to get recovery. So someone who's wanting to be a part of this group, they have to be in counseling first, and they have to get a recommendation letter for the mentorship program from their therapist. And if they're under the age of 18, it does require parent or guardian consent. And then all the mentors that have battled an eating disorder, they have to be in recovery for at least 2 years. So the way that this program works is the mentorship lasts anywhere between 6 months to a year, and they meet at least an hour every week. And this is all done virtually or electronically, so either the phone or video conferencing. And ANAD prohibits the mentors and mentees from ever meeting in person. SAMHSA is our Substance Abuse and Mental Health Service Administration. I absolutely love this website. They have tons of free resources on mental health issues and substance use issues. And then they also have their own national helpline. But if you go to their website, I think it's like the top right-hand corner-ish, there is a tab called Publications. And if you go to that tab, there are hundreds and hundreds and hundreds of free resources that you can have mailed to you. There's books, pamphlets, posters, there's toolkits, resource guides. And if they can't ship them to you, they have the PDF form that you can download and print out or save it to your computer. But all of these resources are free and shipment is free as well. So I highly encourage people to go and look through that. When they switched everything from our crisis, our suicide and crisis lifeline to 988, they created a lot of great resources. They have little like a little treatment plan, a notebook for people who are having suicidal thoughts. They have the wallet cards, they have stickers and magnets. So I highly recommend people check that out. And then here in West Virginia, we have our Help for WV. So they can provide resources, but they also help with referrals for mental health and substance use issues as well. They do have crisis support, and this can be done over their website where they have an online chat support, or you can call them over the phone, or you can also text that 1-844 number and you can text them. So those are the resources that I used for today's presentations. If you have any questions, you are always more than welcome to email me. I have a specialty with eating disorders, but I do not claim to know all the things. So if there is ever any information or questions you have that I do not know, I will absolutely research that for you. And when I find that the right information, I will get that to you. Another thing too, I wanted to point out is I noticed that there were a lot of clinical people on this webinar as well. So I actually have a clinical-based eating disorder presentation that talks about therapeutic modalities that are beneficial in the treatment of eating disorders. If you also would like that too, we can get that sent out to people who are wanting to know some of the therapeutic modalities. So the 3 that I go over in that presentation is cognitive behavior therapy, dialectical behavior therapy, and acceptance and commitment therapy. So that is it has more of a clinical touch to it, whereas this one was more of a general information. So just email me anything, whatever. I am here to provide you any information and any support in any way that I can. So thank you.